Have you ever eaten something thinking it was one of the healthiest choices you could make, only to discover later that it might actually harm you? Most people don't believe a fruit could trigger a life-threatening event like a stroke. But what if I told you it can happen overnight? We've been conditioned to think fruit equals health. And yes, many fruits are packed with vitamins, minerals, and antioxidants. But here's the hidden truth. Not all fruits are created equal. Some can hit your bloodstream like a freight train, flooding it with sugar so fast that your insulin skyrockets. That sudden surge can inflame your arteries, thicken your blood, and push your body into a dangerous state, especially if you already have high blood pressure or are pre-diabetic. Take a look at certain tropical fruits. They taste amazing, they look beautiful, and they make you feel like you're eating something straight out of a health magazine. But they are loaded with a sugar called fructose. Your body processes fructose differently than glucose. It bypasses certain regulatory steps, putting an extra burden on your liver. Your liver converts that excess sugar into fat, and this fat can build up not only around your waistline but also in your bloodstream. When that fat and sugar hit your arteries together, your risk for a clot jumps dramatically. Studies have shown that even one large serving of certain high-sugar fruits can cause a sharp temporary increase in blood clotting factors. That means your blood is more likely to form clots that can travel to the brain and cause a stroke. Now, will this happen to everyone, every time? No, but for those already living on the edge of metabolic issues, this can be the tipping point. The most dangerous part is that you don't feel it happening. You eat the fruit, you feel satisfied, maybe even proud of your healthy choice. Then while you're resting, your blood sugar crashes, your insulin remains high, and your blood becomes thicker. That's the silent moment when the risk peaks. It's not about fear, it's about awareness. If you truly want to protect your brain and heart, you need to swap these high-sugar fruits for low-glycemic, nutrient-dense options. Think berries, kiwi, or even small amounts of citrus. These give you the vitamins and antioxidants without spiking your blood sugar to dangerous levels. Pairing fruit with protein or healthy fat can also slow the sugar absorption and protect your vascular system. Your body is a miraculous system, but it only thrives when we give it the right fuel. Don't just follow trends or marketing. Listen to your body, study the facts, and protect your health like it's your most valuable asset. Because it is. And remember, one small, informed choice today can prevent a life-altering event tomorrow. That choice might be as simple as putting down the wrong fruit and picking up the right one. If you want, I can also make a shorter, punchier version of this speech in Dr. Berg's signature sharp, impactful style for video delivery. Would you like me to prepare that? The surprising fruit that may dramatically increase stroke risk overnight is something most people would never suspect. It's often sitting right there in the fruit bowl, looking fresh, colorful, and completely innocent. You've probably seen it in health magazines, smoothie recipes, and diet plans that swear by its benefits. In fact, you may have been told it's one of the best things you can eat for your health. And yet, under certain conditions, it can set off a chain reaction inside your body that turns dangerous faster than you might imagine. This isn't about demonizing all fruit, far from it. This is about understanding that even natural foods can have side effects if consumed at the wrong time, in the wrong quantity, or by the wrong person. When you bite into this particular fruit, its sugars rush into your bloodstream with surprising speed. Your insulin spikes, your blood becomes thicker, and the delicate lining of your arteries feels the strain. If you already have high blood pressure, atherosclerosis, or blood sugar imbalances, this extra load can be enough to tip you into a high-risk zone, sometimes within hours. It's the kind of risk you won't feel, hear, or see until it's too late. That's why recognizing this fruit and knowing when to avoid it could literally mean the difference between waking up healthy and waking up in a hospital bed. How this fruit affects your blood vessels and circulation is both fascinating and alarming. The moment you consume it, the natural sugars, especially fructose, are quickly broken down and absorbed into your bloodstream. This rapid influx of sugar triggers a cascade of metabolic reactions. Your pancreas responds by releasing a surge of insulin to shuttle that sugar into cells, but in the process, your blood sugar spikes sharply. That spike is more than just a number. It changes the texture and behavior of your blood. It can make it thicker, stickier, and more prone to clotting. At the same time, the sugar surge irritates the delicate endothelium, the inner lining of your blood vessels, causing it to become inflamed and less flexible. Healthy arteries should expand and contract easily to keep blood flowing smoothly, but inflammation can make them stiffer, forcing your heart to work harder. If you already have plaque buildup in your arteries, this stiffness and clot-promoting environment can cause a piece of that plaque to break off, potentially blocking blood flow to your brain. This is why even a fruit that looks harmless on your plate can, under the wrong circumstances, become a silent threat to your circulation and dramatically raise your stroke risk overnight. Why most people think it's healthy and why that belief can be misleading comes down to the way we've been taught to view fruit. From childhood, we've been told, eat more fruit, it's nature's candy and it's good for you. Advertisements, diet books, and even some health guidelines paint all fruits with the same brush, putting them in the always healthy category without distinction. The problem is, that message ignores the fact that fruits vary greatly in sugar content, glycemic impact, and metabolic effect. Many of these so-called healthy fruits are loaded with natural sugars that behave in your body almost the same way refined sugar does, especially if eaten in large amounts or without other foods to slow absorption. Because it's natural, people assume there are no risks, so they feel comfortable eating big portions, even late at night when the body is less prepared to handle a sugar surge. That false sense of security can mask the silent stress this sugar places on your blood vessels, heart, and brain. In reality, a food's origin in nature doesn't automatically make it safe for every person, in every quantity, at any time. Without knowing the differences between high-risk fruits and safer options, people can unknowingly set themselves up for a sudden health crisis, while thinking they're making the best choice for their well-being. The hidden link between blood sugar spikes and sudden stroke risk is one of the most overlooked aspects of nutrition and vascular health. When you eat a fruit that rapidly elevates your blood sugar, your body is forced into emergency mode. Insulin is released in large amounts to bring that sugar down, but during this surge, your blood chemistry temporarily shifts. The excess sugar can cause oxidative stress, which damages the cells lining your arteries. And at the same time, it makes your platelets, those tiny cell fragments that help your blood clot, more active and sticky. This combination of inflammation, vessel injury, and clot-promoting activity creates a perfect storm for a blockage to form. If that blockage travels to the brain, a stroke can occur suddenly and without warning. What makes this link so dangerous is how quickly it can happen, sometimes within hours of eating the wrong fruit in the wrong situation. It's not just a long-term risk from years of poor diet. It can be an immediate trigger if the conditions are right. And because most people think of stroke as something that develops only from chronic habits, they never suspect that a single food choice could contribute to a life-threatening event in such a short time. Practical, safer alternatives you can enjoy without fear start with choosing fruits that have a low glycemic impact and a richer nutrient profile. These are the ones that give you vitamins, minerals, and antioxidants without overwhelming your bloodstream with sugar. Berries like blueberries, raspberries, and blackberries are excellent choices because they're high in fiber, which slows sugar absorption, and they're packed with compounds that actively protect your blood vessels. Kiwi is another great option, offering vitamin C, potassium, and antioxidants while keeping sugar levels moderate. Even small amounts of citrus, like grapefruit or lemon, can give you the refreshing taste you crave with far less impact on your insulin response. Pairing these fruits with protein or healthy fats, such as nuts, seeds, or a bit of yogurt, further blunts any sugar spike by slowing digestion. Timing also matters. Enjoying fruit earlier in the day, when your body is more active and better equipped to use the sugar for energy, reduces the risk of a dangerous spike and crash cycle. By making these swaps and adjustments, you can still satisfy your sweet tooth and get all the benefits of fruit without walking into the hidden dangers that come with certain high-sugar varieties. How small dietary changes can protect your heart and brain long term is something most people underestimate. The truth is, you don't need to overhaul your entire diet overnight to see powerful results. You just need to make consistent strategic adjustments. Simply replacing one high-sugar fruit with a low-glycemic option, or pairing fruit with protein instead of eating it alone, can steadily reduce the stress on your arteries. Over time, these small choices lower chronic inflammation, improve insulin sensitivity, and keep your blood vessels flexible and resilient. This means fewer dangerous spikes in blood sugar, less strain on your heart, and a dramatically reduced chance of clots forming in your bloodstream. Think of it as building a safety net for your cardiovascular system, one meal at a time. And it's not just about preventing strokes, it's about maintaining sharp mental focus, steady energy, and strong overall health for years to come. The most encouraging part is that these protective effects compound. Every smart choice adds another layer of defense. In the end, what seems like a tiny shift in your daily routine can become the very thing that shields you from a life-altering event.